Saccular aneurysms present a substantial medical problem worldwide. It is estimated that 1 in 50 suffer from an unruptured aneurysm, and an average of 230,000 aneurysms are treated each year. Most major hospitals and medical centers have physicians specializing in treating aneurysms. Currently, most aneurysms treated are not diagnosed until they rupture, but advances in diagnostic and imaging technology hope to promote earlier treatment, likely increasing the number of aneurysms treated each year and decreasing death rates due to rupture. This increase in patients will likely lead to an increase in medical centers and physicians focusing on treating aneurysms. Our proposed product is a non-invasive microcatheter system fitted with a small, high-powered laser tip. This laser is capable of sealing saccular aneurysms via rapid occlusion of the blood within the aneurysm. The picture on the right shows the annulase being guided through an artery, which is shown in gray, into a saccular aneurysm. The second guide catheter is not shown to give an improved view of the procedure. Once the tip of the annulase is inside the aneurysm, rapid occlusion will begin and fill the entire aneurysm, effectively sealing the aneurysm and restoring normal blood flow without implanting any foreign materials. The second catheter will prevent any stray clots from exiting the neck of the aneurysm during the procedure. Once the entire aneurysm is clotted, the catheters will be removed and the incision point closed. Our product would be similar to that of catheters used in current coiling techniques, in which a catheter is inserted through the femoral artery and threaded up to the location of the aneurysm with the aid of fluoroscopy. A second microcatheter equipped with a laser would then be inserted into the first catheter to help guide it to the needed position and angle. Once the laser was in place, it would then begin radiating the stagnant blood to cause thrombosis, which would then prevent new blood from entering the aneurysm and restoring proper blood flow. Although there are several techniques for correcting aneurysms already on the market, our method has several benefits over existing technologies. The main selling point of our product is the fact that no open surgery is required and no foreign object needs to be permanently implanted into the body, thus decreasing the inherent risk of immune response and bacterial infection. In addition, the only large cost associated with our product is the one-time cost of the instrument itself, although catheters will need to be purchased for each patient, which is cheaper than the alternative non-reusable treatments such as implanted platinum coils. Thus, in the long run, our treatment method will be cheaper for physicians and hospitals, even though initial costs would be slightly higher. Our team would like to create a strategic partnership with Helix Medical, a company that manufactures surgical catheter systems. This partnership would allow us to focus on the micro-laser part of our design, which could be fitted with a traditional detachable end to allow for the use of a generic surgical catheter system. In addition, this partnership would present Helix Medical with an opportunity to expand their market. We would package some of Helix's catheters with our device during sale and recommend these catheters to be used with our device when doctors need to purchase more. In return, we would take a sales commission. We would also be interested in making a similar strategic partnership with one of the larger medical device companies, licensing that company to manufacture our product on a large scale in return for some portion of the profit generated by the sales of each device. This would be a more feasible option than trying to manufacture the product ourselves, due to insufficient resources to manufacture the device efficiently.
Because the nature of our product is a medical device designed to treat aneurysms, our target market could potentially consist of any demographic of individuals. However, there are certain groups who are more prone to developing aneurysms than others. According to the National Heart, Lung, and Blood Institute, men are more likely than women to develop aneurysms, as well as those over 65 years old. Additional at-risk groups include cigarette smokers, those with a family or individual history of aneurysms, and those individuals suffering from certain diseases such as hypertension and atherosclerosis. Even those individuals without any of these risk factors still have the potential to develop an aneurysm, as they can also be caused by trauma such as a motor vehicle accident. Since aneurysms are not discriminatory, we can expect that people of all ethnic backgrounds, income levels, and educational backgrounds would be part of our target market, although some groups may be more likely to seek out and afford treatment than others. Individuals who do not care for their health or do not have health insurance would likely not be part of our target market. However, the recent legal change mandating individual health insurance coverage will likely make our product more accessible to those in need of treatment regardless of their socioeconomic status. There are several companies that have developed technologies meant to treat saccular aneurysms. Aesculap manufactures several different kinds of MRI-safe aneurysm clips that can be used surgically to close off the neck of an aneurysm. Neurovasc manufactures a platinum coil system that can be inserted through a catheter and wrapped into a tight ball within an aneurysm to treat it without any open surgery. Covidin has a stent-like device that can be inserted along the artery wall to block off an aneurysm, also successfully treating it without open surgery. Anuclose is a relatively new company that is currently working on development of 9 different products, including a clip, an aneurysm net, and an aneurysm occlusion device. They do not currently have any FDA-approved products, however. Another potentially relevant product is the Turbo Elite Laser atherectomy catheter that is very similar to our proposed device. It consists of a catheter with a laser tip that illuminates tissue in the ultraviolet frequency range in the electromagnetic spectrum. It is not currently used as a device to promote thrombosis inside the dome of an aneurysm, however. Its main use is to treat multiple morphology lesions, which may comprise of atheroma, fibrosis, calcium, and thrombus. Once the necessary amount of investors and ventures are found, equipment will be purchased from various vendors, including Helix Medical for the catheter tubing. 2 members of our team will specialize in design and development, while the other members will help when needed and perform the roles of finance director, accountant, managing director, president, and FDA regulations specialist. As the product gets closer to completion, new members may be necessary to take on the roles of sales marketing director and the production director. Upon completion of our project, production and distribution will become the main focus of our company. Quality control will be very important in order to build up a reputation necessary to capture a large portion of potential customers. It will also be necessary to develop a marketing plan to quickly inform hospitals, doctors, and their patients of our new technique. Our team currently consists of 5 members who are responsible for the conceptual design of the Annulase product. The team originally came together as part of an entrepreneurship for engineers class while they were students at Arizona State University. Currently, the 5 team members, Amanda Witten, Marky Olson, Sandy Moore, Ryan Andrew, and Abdullah Alwatban, have equal parts equity in the company. No other investors or team members have yet been recruited to the project. Since an aneurysm treatment is likely not something an individual will seek out information on unless they are diagnosed with an aneurysm, our main marketing focus will be towards the doctors and medical facilities that treat the condition. Typically, when a patient is diagnosed with an aneurysm, they will have a consultation with their doctor to discuss treatment options and the risks, benefits, and costs associated with each option. Thus, our main focus will be to inform the doctors who perform these types of treatments of our product so that they can present it as a viable treatment option to their patients, highlighting the lower risks and costs that we've incorporated into our product. We believe this will demonstrate that our product is a better alternative than other current treatment options. Potential ways to reach these physicians would be speaking at hospitals and medical conferences, as well as putting ads in common medical magazines and journals, particularly those who specialize in cardiovascular topics.
Our main source of revenue will be from selling our laser device to physicians. Aneurysms are a global problem with 230,000 treatments each year, and a cheaper and more efficient product could capture a large portion of this market. However, revenue would only be generated after the product passed FDA approval and entered the marketplace, which typically takes 10 years. Therefore, our initial cost will be extremely high, but the end income generated from sales would quickly surpass the debt and begin to generate a steady profit after 10 years. To aid in our early stage growth, ventures, angel investors, or other individual investors would be required to obtain startup capital. Currently, personal funds of our team members are our main funding source, but we plan to present our future product to several ventures, including Acutive Medical Ventures, Advanced Technology Ventures, Alliance Technology Ventures, Alpha Capital Partners, Capital Southwest, and Cordova Ventures. Between these different ventures' contributions, it is expected that we will achieve the required capital to bring our product to market. The bulk of our funds would be used for the research and development and lab space required to obtain FDA approval. We must also pay our employees, which will represent a large portion of our cost.
There are several assumptions that come from our financial projections. The first being that ventures will wait until the product hits the market to receive payment. This is assumed to be about 10 years from now. With the device being newly released, the sales in the first couple of years will be low, but will grow as the product becomes more well known. With a growing population, the number of aneurysms will increase. This will cause an increase in the demand for our devices, which is projected to be around 57,500 devices that will be purchased each year. With the help of investors and ventures, we will obtain the required $7 million and distribute it among these three categories: research and development, salaries, and lab space. Since the expected time to develop the annulus is approximately 10 years, the respective cost required to pay 5 researchers $60,000 a year takes up around 44% of the funds. The cost of catheters is relatively low, and thus the materials necessary to develop the product will be cheap. The cost of the laser components, along with satisfying the FDA regulations, will be the main expenses in the research and development section. The table that you see compares our company's gross value, total expenses, and net income over a time span of 5 years. Due to the fact that our company is developing a medical device that is expected to enter the market in 10 years, we will have no revenue during this time period. The cost of goods will also be zero, due to the fact that our product will not be complete for 10 years. Other expenditures will be present, such as the cost of lab space and necessary means for research and development. Keep in mind that this is an approximation and can vary greatly depending on how long the product actually takes to develop. This chart illustrates the income statement table from the previous slide. From this chart, we see that the total expenses initially starts out high, but then decreases to a fairly constant rate. This initial increase in the expenses is due to the assumed price of lab equipment, which would be purchased early in the research and development stage. Though the cost appears to increase significantly again after the first year, this apparent increase is due only to the fact that the time interval changes from quarterly to annually. There is no break-even point for our company, as the product will not reach the market within 5 years. This table compares our company's assets, liabilities, and equity over a 5-year period of time. Our company will obtain substantial capital from investors and ventures based on our initial intellectual property. Thus, our cash available will be initially high. Our total assets is simply our remaining cash available at each point in time. Our liabilities is our debt to our investors, which will be constant based on the original amount borrowed. As for our total equity, it is equal to our assets minus our total liability at each point in time, and this table is an approximation and could vary greatly from the actual numbers.
This chart illustrates our balance sheet data. We can see that the total liabilities we have in terms of debt remains constant throughout this time period, but the assets we have in the form of cash from the ventures we now owe debt to decreases. Thus, we are forced to take on the cost of the debt as part of our equity until the product hits the market and starts generating income. We will not reach positive ROI within the 5-year period projected. Since we are in the research and development stage and not earning revenue, we have no deductibles. Thus, our adjusted net income is the same as our original net income. Similarly to the previous table, we include all of our other costs in separate labeled rows, causing this other row to be 0. Since our adjusted net income is essentially our ending cash, they are equivalent. This table is an approximation and could vary greatly from the actual numbers. This chart illustrates our cash flow data. We can see that our initial adjusted net income is significantly lower in the negative range than the rest. That is because of our higher initial costs. We do not have any costs or benefits that could be considered outside of what was initially calculated, so other does not apply. Thus, our ending cash supply is the same as our adjusted net income. Both income and ending cash will be negative until our product hits the market, so positive ROI is never reached.